own. The thing is that with CBD, we have the receptors, but at some point or another, for some reason, they stop working as well. So when you introduce CBD, it's a magic. They function together.
It sparks it back up.
Exactly.
Okay, so I want to go back to the graphic because I want to break something down, which is when you say neuroprotective, what do you mean by neuroprotective? Are we talking about conditions like stroke? Are we talking about Alzheimer's and Parkinson's, as you mentioned?
It works, it protects with Alzheimer's, helps patient with Alzheimer's,
okay,
patient with autism.
In what way?
Because it helps them, their function, their ability to have less movement. They're focusing, to focus better.
Right.
In all this area, because it works in your synaptic membrane, in the receptors in the brain.
Is that the CB1 receptor?
Is the CB1 receptors,
that's
correct.
It's in your brain?
In your brain. You have it in your cerebellum and in the hippocampus.
Okay. I've also heard that it can help with recovering alcoholics as well, or addicts. Is this true? How?
Because it has as an antagonist. It has an antagonistic effect on the receptors.
Can you explain that a little bit? It's
sort of, let's say, it blocks the receptor, adheres to the receptors.
Okay.
So it decreases your appetite, your urge. Your urge to use. It decreases the urge.
Okay.
To use this other. Products.
Right. That's interesting. Now, before we continue our conversation, I just want to take a minute to remind our viewers to call in and join the conversation. Ask a question. Dr. Hernandez is here on standby for you. That number is 855-796-4475. Now, doctor, something that we also mentioned is it can be used as an anti-seizure. So I want to talk a little bit about epilepsy, and it's given to patients who experience seizures, correct?
Correct. Actually, the first time that it was used, there's a CBD brand called Charlotte's Web.
Yes.
And it's because of the little girl, her name was Charlotte. She was having uncontrollable seizures, and her family was desperate. Her grandfather actually went out of his way and looked for CBD, and they started using it, and she recovered from having multiple seizures, maybe having one, and it's used in that for that treatment. Actually, GW Pharma, which is a pharmaceutical company, just produced and is FDA approved this past summer a medication called Epidiolex, which is made from CBD.
When children have chronic conditions, is it safe to use CBD to manage these conditions?
It is for children, pregnant women, lactating women. It's a very clean product.
So would they be given at a hospital as well if someone is prescribed, or is that a little tricky?
Now, up to this point, I don't think hospitals are using it, even though there's a pharmaceutical company with a product out there. There's still a lot of misconception. There's a lot of physicians, they don't even know what CBD is,
right.
Which is unfortunate. You tell a physician CBD, they think it's, oh, no, I'm prescribing that is marijuana,
right.
Which is totally wrong.
Which is a misconception that many, not just doctors, many have as well.
Correct. Absolutely.
So I do want to reaffirm and share with our viewers at home that if you are, whether you're a child or someone who's pregnant, you have to have a prescription from the doctor, correct? Or orders from the doctor, a conversation with your doctor.
You should, because if you're taking medication, there's some medication that it should, because it metabolizes through the liver, CBD. So if you're taking medicine, you should not stop your medication. Talk to your...
What are conditions that it would not help with?
To be honest with you, the studies are so broad and it helps in so many ways that I don't think it can harm anyone.
Right.
Even from diabetes to it helps with if you have gastritis. It has so many, that's why I call it a super oil, because I haven't found any condition that can harm you.
I know there are obviously amazing benefits to it, but we definitely need to discuss some of the risks as well. So are there any risks or side effects with taking CBD oil?
It has been studied and shown that it can increase your liver enzymes in some patients, in some people that use it, because it gets metabolized through the liver. And getting a blood test every couple of months, it doesn't hurt anyone when you go to your physician. And it can have maybe some, even though it's an antiemetic, it can cause in some people nausea.
I mean, it also, we discussed that it can be used to help with depression, but one of the side effects, it can also give you depression?
I wouldn't say that per se can make you a little antsy, a little bit anxiety, a little hyper. And like everything else, like all medications, you know, this is not a medication.
Right.
But like everything have flip coins, you know, but it's a minimal amount, I think. It's not the most common.
Right. And blood pressure, is that something to be weary of as well?
No, not at all. It controls actually, people that take it, it lowers the blood pressure, because people with very high blood pressure, because it calms you down, it relaxes you.
Right.
It causes your homeostasis to be balanced. It causes balance.
And one of the things that you have mentioned throughout the show so far is that you say, do not get off your medications, and you don't promote that. So does it interfere with medication, the CBD?
There's some medication that can interfere, special medication that are metabolized through the liver.
Okay.
So always talk to your doctor.
Always talk to your doctor, absolutely. Now coming up, where do you get CBD oil and what products are on the market? Also, Dr. Hernandez mentioned the amount of beauty products women use on their skin containing ingredients that could cause cancer. So what ingredients should we steer clear of? It's all coming up next, so don't go anywhere. You're watching the Health Channel, all health all the time on South Florida PBS. If you have a question for Dr. Hernandez, please call in using the toll-free number 855-796-4475. And remember, you can take the Health Channel wherever you go by visiting our website, allhealthtv.com. You can watch the Health Channel live 24/7 or check out videos from previous episodes. We'll be right back.
A concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes your head and brain to move rapidly back and forth. This sudden movement can literally cause the brain to bounce around or twist in the skull, stretching and damaging the brain cells and creating chemical changes in the brain. What you might not know is that these chemical changes make the brain more sensitive to any increased stress or injury until it fully recovers.
Ovarian cancer is devastating and difficult to diagnose. It's often only caught in advanced stages, and 4 out of 5 women will see the deadly disease return.
I knew when ovarian cancer recurs,
it's often incurable.
It was terrifying, waiting for the other shoe to drop.
Until recently, following chemotherapy, women with recurrent ovarian cancer had to simply watch and wait for their disease to come back.
well, we say,
Not on my watch.
Not on my watch.
Not on my watch. Now, with maintenance therapies, women can extend their time in response and delay recurrence.
knowledge and awareness of your choices empowers you.
And gives you a greater sense of control.
Let's call for a change in ovarian cancer care.
The Not on My Watch movement empowers women facing recurrent ovarian cancer to take an informed and active role in managing their disease. Visit notonmywatch.com to learn more.
(1945 to 1965). People born during these years are 5 times more likely to have hepatitis C, a leading cause of liver cancer. And people can live with hepatitis C for decades without any symptoms. The good news? Now, treatments are available that can cure hepatitis C. So if you were born from 1945 to 1965, talk to your doctor about getting a blood test for hepatitis C. It's the only way to know.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio, and with us is Dr. Milagros Hernandez, internist and rheumatologist. If you have a question for Dr. Hernandez, please call in using the toll-free number, 855-796-4475. We'd love to hear from you. Now, this hour, we're talking about CBD oil, the healing properties behind it. But how do you know what type to get? So there are so many different kinds. So can you help out our viewers at home? What are the different types that you can get CBD oil?
You can get CBD from hemp, which is regulated, but it's legal.
Okay. But in terms of you can get it in edibles, correct? Or spray? And
You
what
can
form?
get it on edible. You can get on tincture, which is the oil. If you want something there are tablets as well. If you want something reputable, you should get from Lord Jones, AE Labs, Charles Webb, which are a reputable company. They're the pioneers.
Right.
And investigate your lab, the lab that it comes from, where they get their hemp from.
Now, what about topical creams? I know you mentioned that that's just on the surface, so it doesn't get absorbed, but there are creams that do?
None of the creams get absorbed in the bloodstream, none of them. You have to ingest, to get absorbed in the bloodstream, it has to be ingested, either in form of tablet or oils.
Okay. Now, is it true that if taken, let's say, like, as an edible or maybe a gummy, it's in your system a lot longer?
I don't believe so. It works the same way.
It works the same way.
As a tincture.
And there's even something, now you can get them in forms of bath bombs.
But they're wonderful.
Is this true?
It is true.
Okay, so you just dump it in the bath?
The bath, and you go in there and all your muscles, they relax.
Okay.
Because it's a total relaxation. I have tried them.
It's a little better than Epsom salt, right?
It is. Actually, there's Epsom salt with CBD now.
There is.
There is.